In a geriatric surgery program, a thorough medication review is one of the steps we take to ensure your safety throughout the surgical process. This is consistent with our dedication to being an age-friendly healthcare system. Before surgery, your healthcare provider will review your medication to determine whether you are on a routine that is safe for you. During this review, your healthcare provider will also determine if they need to add medications in preparation for your procedure or after the procedure for post-surgery treatment. To prepare for the medication review with your healthcare provider, you should share all of the prescriptions and over-the-counter medications you take. To help you remember these, make a list or bring all your medications with you. Make sure to discuss any side effects you have when taking your medications, such as dizziness, fatigue, or nausea. Before meeting with your provider, it's also a good idea to have a list of questions to ask during the medication review before your surgery. For example, some questions you may want to ask include: why am I taking this medication? When and how often should I take this medication? How long do I have to take this medication? And what side effects might I expect with this medication? Due to an increased risk for multiple chronic conditions, an older adult may be on many medications at once. When they are taking 5 or more at the same time, this is referred to as polypharmacy. During the review, your healthcare provider will address polypharmacy through medication reconciliation. This is when they determine what medications you should continue on or stop taking. In completing your medication reconciliation, providers will refer to a guide that lists medications proven to be harmful to older adults or that warrant extra caution in older adults. For example, certain diabetes, cardiac, and mood-altering medications are included in this guide and may be flagged by your provider. Medications your healthcare provider may discontinue include medications that may have been appropriate for you in the past but may be harmful or of little benefit to you now, and prescription medications that you haven't filled in over 4 months. As part of the medication review, your healthcare provider will also ask you questions to get a complete picture of your medication routine. Make sure to answer these honestly so your healthcare provider can make an accurate assessment. Questions your healthcare provider may ask include: do you have all of the medications you are prescribed? Do you understand why you are taking your medications? Do you ever forget to take your medications? Do any of your medications make you sick? If you feel worse, do you stop taking your medications? If you feel better, do you stop taking your medications? At the end of the medication review, your provider will discuss any changes that should be made in your routine. This can include changing medication doses, telling you to stop taking certain medications, and prescribing you new medications. Remember, you can help your healthcare provider review your medication to ensure your safety. You can do this by sharing all of the prescription and over-the-counter medications you take, as well as any supplements, making sure to come prepared with any questions you have about your medications, and by being prepared to honestly answer any questions your provider may have. Working with you as a team, we aim to make sure you are on a safe medication plan before and after your surgery,